Do you wake up in the middle of the night needing to urinate? This may not just be part of aging. There is a common mistake made by many people that is directly linked to this nighttime discomfort. In this video, you will find out what this mistake is, why it mainly affects older people, and what can be done to improve your night's sleep. For a long time, it was believed that waking up several times a night to urinate was an inevitable consequence of aging. Although age-related factors do influence this process, there is a fairly common and underestimated mistake that significantly aggravates this condition: inadequate fluid intake before bedtime. This habit, often done automatically and without reflection, is among the main culprits of sleep disruption in older adults, and in most cases can be adjusted with simple behavioral changes. To better understand this mistake, we first need to understand how fluid balance works in the human body. Throughout the day, our bodies constantly consume and eliminate water. This process is regulated by a complex interaction between the brain, kidneys, hormones, and bladder. When we drink water or other liquids, this volume circulates through our system until it is filtered by the kidneys and temporarily stored in the bladder, from where it will be eliminated. The problem begins when this natural cycle becomes disrupted during the night. Many people, out of fear of dehydration or out of habit, consume large amounts of water or other beverages in the hours before bedtime. In some cases, this consumption is not only intentional, but also unconscious. Drinking a relaxing tea, soup for dinner, a glass of milk before bed, or even water to take medicine. All of this contributes to the volume of fluids circulating in the body when the body should be slowing down its functions. Contrary to what many people think, fluid intake does not need to be distributed evenly throughout the day and night. In fact, it should be concentrated mainly in the morning and afternoon, gradually decreasing as bedtime approaches. The human body has natural mechanisms to reduce urine production at night. One of them is the release of the antidiuretic hormone, known as vasopressin. This hormone acts by decreasing the amount of urine produced by the kidneys during sleep, contributing to a more continuous and restful night. However, this process can be easily compromised when the volume of fluids ingested at night exceeds the body's regulatory capacity. Even with the action of vasopressin, if there is excess water or beverages ingested in the hours before sleep, the kidneys will be forced to maintain active urine production, leading to bladder filling and, inevitably, awakening. Another aggravating factor is the type of liquid consumed. Not all liquids have the same effect on the urinary system. Caffeinated beverages, such as coffee, black tea, and soft drinks, have diuretic properties that stimulate the kidneys to produce more urine. The same is true for alcoholic beverages, which not only increase diuresis, but also negatively affect sleep quality. Even natural juices, such as watermelon, melon, or orange juice, are rich in water and sugar and can accelerate this process when consumed at night. In other words, it is not only the amount of liquid that matters, but also its nature. In the case of the elderly, the impact of this mistake is even more significant. Over the years, the bladder's capacity to store urine decreases, which reduces the interval between urination. In addition, the signals sent by the body to warn of a full bladder become more intense, causing frequent awakenings. Thus, when there is excessive fluid intake in the hours before bedtime, the bladder, already more sensitive and with less capacity, cannot store the extra volume for long. The result is the need to get up one or more times during the night to urinate, compromising sleep quality and consequently overall health. The consequences of this mistake go beyond the simple inconvenience of interrupted sleep. In the medium and long term, the effects of poor sleep quality accumulate. Repeatedly waking up during the night negatively affects memory, mood, concentration, and the immune system. For older adults, this impact is even more serious, as fragmented sleep is associated with an increased risk of falls, depression, cardiovascular disease, and even dementia. In addition, the simple act of getting up in the dark to go to the bathroom increases the risk of household accidents, such as slips and fractures. It is important to emphasize that hydration is indeed essential for health, especially in older adults. However, it must be distributed intelligently throughout the day. Ideally, fluid intake should be concentrated up to a maximum of 2 hours before bedtime. After this period, intake should be reduced to the bare minimum, such as small sips only if thirsty or to take medication. In addition, it is recommended to avoid foods with high water content at dinner and to empty the bladder completely before going to bed. These small adjustments can make a significant difference in sleep quality and urinary health. Finally, it is important to note that even with these precautions, if a person continues to wake up frequently to urinate at night, there may be other factors involved, such as hormonal disorders, enlarged prostate in men, urinary tract infections, uncontrolled diabetes, among others. In this case, the guidance of a urologist or geriatrician is essential to investigate and treat the cause appropriate. But in the vast majority of cases, it all starts with a simple mistake: drinking too much at night. Correcting this habit can be the first step toward more peaceful nights and more productive days. After all, quality sleep is not a luxury. It is an essential need for health, especially as we age. Throughout life, our bodies undergo a series of physiological changes. Many of them are noticeable in the mirror, such as wrinkles, loss of muscle mass, or gray hair. But other changes, more silent, happen internally, affecting the functioning of entire systems. One such system is the urinary system, which changes considerably over the years. The need to get up during the night to urinate, a phenomenon known as nocturia, is directly related to these changes, and understanding this process is essential to dealing with the problem more effectively. In youth, the bladder has a large storage capacity, and urinary control mechanisms work quite efficiently. Urine production is naturally reduced during the night, thanks to the action of specific hormones, allowing most people to sleep for several hours uninterrupted without feeling the urge to urinate. With aging, however, this dynamic undergoes profound change. One of the main changes occurs precisely in the production of these antidiuretic hormones, such as vasopressin. This hormone is responsible for signaling the kidneys to decrease urine production during sleep. With age, vasopressin levels and effectiveness tend to decrease, causing the kidneys to continue producing urine in volumes similar to those during the daytime, even during the night. In addition, there is an important change in the structure and functioning of the bladder itself. The muscles of the aging bladder tend to become less elastic, which means that it loses some of its ability to expand and store urine. This reduction in functional capacity causes the bladder to reach its limit more quickly, even with relatively small volumes of urine. The result is the need to urinate more frequently, including at night. This condition is further aggravated by the so-called overactive bladder, common in older adults, characterized by involuntary contractions that cause urinary urgency, that is, that sudden feeling that you need to urinate immediately. In men, an additional factor comes into play: the natural enlargement of the prostate, a condition known as benign prostatic hyperplasia. This enlargement, while not necessarily a sign of cancer, can compress the urethra, the tube through which urine passes, and make it difficult to empty the bladder completely. This causes the bladder to retain small amounts of urine even after urination. During the night, as more urine is produced, the residual accumulation adds to the new volume, quickly leading to discomfort and requiring another awakening. In women, changes resulting from menopause, such as falling estrogen levels, affect the tissues of the lower urinary tract, making them more sensitive and prone to irritation, which can also cause urgency and frequent urination. Another important point is that with aging, changes occur in the circadian rhythm, our internal biological clock. This rhythm controls various processes in the body, including sleep, digestion, and yes, urine production. In older adults, this cycle can become disrupted, causing the body to function less in sync with natural day and night patterns. This contributes not only to sleep disturbances in general, but also to changes in urine production patterns, making it more common to get up during the night to empty the bladder. It is also important to consider that many older adults live with other health conditions that directly influence the functioning of the urinary tract. Diseases such as diabetes, heart failure, sleep apnea, and neurological diseases affect urine regulation and significantly increase the chance of episodes of nocturia. In the case of diabetes, for example, high blood glucose levels increase the amount of urine produced, a symptom known as polyuria. In cases of heart failure, the body can retain fluids during the day, especially in the legs and feet, which are reabsorbed at night when the person lies down, a process that increases urine production during sleep. In addition to physical changes, psychological and behavioral factors cannot be ignored. Over time, many older adults develop greater sensitivity to small stimuli and have lighter sleep. This means that any slight discomfort, such as the bladder starting to fill, can be enough to interrupt sleep. Anxiety related to fear of urinary incontinence also causes some people to wake up just to make sure their bladder is empty, even if there is no real sign of urgency. This anticipation becomes a repetitive cycle that, over time, permanently alters sleep patterns. It is curious to note that nocturia is rarely treated as a clinical condition in its own right. It is generally seen as a secondary symptom, something that is part of aging. This perception contributes to many people simply accepting the discomfort without seeking medical help or investigating possible causes and solutions. However, as has been demonstrated by several studies, nocturia is a risk factor for several serious complications, such as nighttime falls, fractures, depression, and cognitive decline. Therefore, understanding its physiological root is an essential step not only to improve sleep quality, but also to preserve the autonomy and well-being of older adults. Therefore, the need to urinate during the night is not a simple detail of aging, but rather the result of a set of hormonal, anatomical, and functional changes that occur over the years. These changes are not the same for everyone, but they affect most people progressively. The good news is that by understanding the mechanisms involved, it is possible to intervene with personalized strategies, whether through lifestyle changes, medical advice, dietary adjustments, control of associated diseases, or even the use of specific medications when necessary. It all starts with the awareness that this phenomenon has a cause, an explanation, and often a solution. Nocturia, or the act of waking up during the night to urinate, is often associated with physiological issues related to aging, such as as hormonal changes and reduced bladder capacity. However, there is a factor that is just as powerful as these biological aspects, but is often overlooked: diet. What we eat and drink in the hours before bedtime can play a decisive role in the amount of urine produced during the night, bladder irritation, and even the body's ability to maintain deep, uninterrupted sleep. There is a direct link between certain foods and beverages and the functioning of the urinary system, and understanding this relationship is essential for anyone who wants to deal with nocturia effectively and permanent. To begin with, it is important to understand that some foods and beverages have diuretic properties. This means that they stimulate the production of urine by the kidneys, even when the body is not necessarily in need of eliminating excess fluids. Caffeine is one of the main examples of this class of substances. Found in coffee, black and green teas, cola-based soft drinks, and even chocolate, caffeine acts directly on the kidneys, promoting more intense blood filtration and increasing urine volume. When consumed in the afternoon or evening, it not only makes it difficult to fall asleep due to its stimulating effect on the central nervous system, but also causes increased kidney activity, filling the bladder more quickly and requiring more frequent emptying. Alcoholic beverages also fall into this group of substances with a diuretic effect. Alcohol interferes with the production of vasopressin, the antidiuretic hormone that normally reduces urine formation during sleep. By inhibiting this hormone, alcohol causes the kidneys to continue producing large amounts of urine, even while the body is trying to rest. In addition, alcohol has an irritating effect on the lining of the bladder, making it more sensitive and triggering urinary urgency with smaller volumes. For older adults who already have a reduced bladder capacity and increased sensitivity, the effects of alcohol are even more pronounced. Just one glass of wine or beer with dinner can trigger a series of trips to the bathroom throughout the night. Another important group of foods are those with high water content. Fruits such as watermelon, cantaloupe, pineapple, and oranges are composed largely of water. Although healthy and rich in nutrients, when consumed in large quantities at night, these fruits contribute to an increase in the volume of fluids circulating in the body, overloading the kidneys and bladder at a time of day when it would be ideal to slow down kidney function. Natural juices from these fruits, which are often consumed at dinner, carry the same risk. They seem harmless, even healthy, but their effect on nighttime urination is significant. Foods rich in sodium, although not diuretics in the direct sense, also affect nocturia indirectly. When we eat too much salt, found in processed meats, fast food, and even aged cheeses, the body tends to retain fluids to maintain the osmotic balance between blood and tissues. However, this retention is temporary. During the night, especially when a person lies down, the body begins to try to eliminate this excess sodium, which requires greater urine production. This is one of the reasons why people who eat salty meals at night, such as pizza, lasagna, or frozen ready meals, often wake up in the middle of the night with the urge to urinate. Another factor that deserves attention is acidic and spicy foods. Spicy sauces, highly seasoned foods, or foods prepared with vinegar, as well as acidic fruits such as pineapple, lemon, and tomato, can irritate the bladder lining. This irritation causes involuntary contractions of the detrusor muscle, which is responsible for emptying the bladder, creating a feeling of urinary urgency even when there is little urine stored. In people with sensitive bladders or who already experience symptoms of overactive bladder, this effect is even more noticeable. The result is sleep interrupted not only by physiological need, but also by an uncomfortable and insistent feeling that you need to go to the bathroom. There is also the case of artificial sweeteners, often used in diet products and zero-sugar soft drinks. Substances such as aspartame, sucralose, and saccharin can act as bladder irritants in some people, causing increased urinary frequency and nighttime discomfort. Although they do not have the same volume of liquid as other beverages, these products can be treacherous by causing nighttime urination without the user realizing the direct relationship between what they have consumed and what they are feeling. The time of day when these foods and beverages are consumed also makes a huge difference. Often the problem is not only what was consumed, but when it was consumed. A cup of coffee in the late afternoon, a soft drink during dinner, or a natural juice in the evening may seem like harmless choices, but they profoundly compromise the nighttime urinary cycle. The human body needs time to process fluids, and the interval between consumption and bedtime should be at least 2 to 3 hours. This allows the kidneys to filter excess fluids and the bladder to empty before sleep, significantly reducing the risk of nighttime interruptions. Despite all these factors, it is important to note that the body's response to certain foods and beverages varies from person to person. While some individuals are extremely sensitive to the effects of a cup of green tea at night, others can consume it without without any noticeable consequences. Therefore, personal observation is a valuable tool. Keeping a food diary for a few days, recording everything consumed after 6 p.m., and correlating it with the number of times the person woke up at night can reveal surprising patterns and help identify specific triggers in each case. The role of diet in urinary health is real, measurable, and, fortunately, controllable. Small changes in the evening menu, such as avoiding caffeinated beverages, reducing consumption of very watery fruits, or leaving spicy foods aside, can bring significant relief to those who suffer from nocturia. It is not about giving up the pleasure of eating, but rather making more conscious choices that are tailored to the body's functioning, especially at night. In many cases, the answer to sleep interrupted by frequent trips to the bathroom may be hidden inside a medicine bottle. Although medications play a key role in managing chronic diseases, especially in older adults, it is important to recognize that they also have significant side effects, some of which directly affect the bladder, kidneys, and sleep cycle. Among these effects, nocturia caused by certain medications is one of the most disruptive to nighttime rest and, consequently, to overall health. The big challenge is that people often do not make the connection between the medication they take and the need to get up to urinate, believing that this is solely due to age or diet. However, the impact of certain medications on urinary function can be profound and persistent. The group of drugs most directly associated with nocturia are diuretics. They are widely prescribed for the treatment of conditions such as high blood pressure, heart failure, and fluid retention. Their mechanism of action is clear. They stimulate the kidneys to eliminate excess sodium and water from the body, reducing blood volume and consequently blood pressure. However, by intensifying renal filtration, diuretics significantly increase urine production. When taken in the late afternoon or evening, their effect persists during the first hours of sleep, filling the bladder and leading to the need to get up to urinate, often more than once a night. The impact is even greater among the elderly, whose urinary system already has a reduced tolerance for fluid accumulation. Most concerning is that many patients are not advised on the best time to take this type of medication. Simply changing the dose to the morning, under medical supervision, can often reduce or even eliminate episodes of nocturia. But diuretics are not solely responsible. A number of other medications can indirectly influence urinary frequency. One example is antidepressants. Although essential for the treatment of depression and anxiety, some tricyclic antidepressants and selective serotonin reuptake inhibitors, SSRIs, can interfere with the neurological regulation of the bladder. In some cases, these drugs alter the bladder's sensitivity threshold, causing the brain to interpret moderate filling as urinary urgency. In addition, certain antidepressants also affect sleep architecture, fragmenting cycles and making it easier for small stimuli, such as a partially full bladder, to wake the patient. Another relevant group is heart medications, such as beta blockers and calcium channel blockers. Although essential for controlling blood pressure and preventing cardiovascular events, these drugs can affect the tone of smooth muscles, including those of the bladder. This can lead to urinary retention or incomplete emptying, resulting in urine accumulation and more episodes of urination during the night. There are also ACE inhibitors, angiotensin-converting enzyme inhibitors, which, in addition to their cardiovascular role, have been associated with side effects such as dry cough and increased urine production, especially in sensitive patients. Medications for the treatment of diabetes, such as some types of sodium glucose cotransporter 2 (SGLT2) inhibitors, are also worth mentioning. They promote the elimination of glucose through urine, which inevitably increases urinary volume. Their effect, although positive in glycemic control, can manifest itself in more frequent episodes of urination, including during the night. Diabetics who notice an increase in nocturia after starting new medications should discuss with their doctors the possibility of adjusting dosages or administration schedules. Anxiolytics and sedatives used to induce sleep may seem contradictory in this context. After all, their purpose is precisely to improve rest. However, many of these drugs alter the natural structure of sleep, suppressing deeper phases and prolonging lighter stages. This means that the individual may wake up more easily at the slightest stimulus, including a full bladder, which under normal conditions would not be enough to cause awakening. In addition, prolonged use of these medications can lead to tolerance and dependence, causing sleep to become increasingly fragmented over time. Another factor to consider is dietary supplements and herbal remedies, which are often used without a prescription or proper guidance. Substances such as green tea, hibiscus tea, horsetail, among others, are popular for their diuretic or detoxifying effects. However, these effects, when poorly managed, also contribute to nocturia. Many consumers ingest them at night, believing that they will bring benefits during sleep, without realizing that they are stimulating nighttime urine production and directly interfering with the quality of rest. The bottom line is that each body reacts differently to medications. Age, overall health, kidney and bladder function, as well as the combination of different drugs, create a unique scenario for each patient. Therefore, it is essential that any change in urination patterns patterns, especially when it interferes with sleep, be discussed with your doctor. Often, simply adjusting the time of administration, switching to an equivalent with fewer urinary side effects, or revising the dosage can significantly alleviate symptoms. But this requires awareness and vigilance. Patients must be attentive to how their bodies respond to each treatment and feel free to share these observations with their healthcare professional. In an increasingly medicalized society, the balance between treating disease and preserving quality of life has become a central challenge. Medication-induced nocturia is a clear example of this. While seeking to control one condition, we may end up compromising another, especially sleep, one of the most important pillars of physical and mental health. Understanding the role of medications in this process is therefore a fundamental step in restoring this balance, promoting healthier, more conscious aging and more peaceful nights. Among the factors that contribute to an increased urge to urinate at night, there is an often underestimated but extremely influential category: nighttime habits. Small behaviors incorporated into our routine, seemingly harmless, have the potential to profoundly affect the functioning of the urinary system and consequently the quality of sleep. The way we prepare for sleep, what we do in the last few hours before bedtime, the foods and liquids we consume, and even the environment in which we rest are elements that, when combined, can stimulate the bladder and force us to interrupt our sleep to go to the bathroom. Critically analyzing these habits is essential, especially among older adults for whom light sleep and natural physiological changes make nighttime a particularly sensitive time. One of the most common mistakes is not emptying the bladder completely before going to sleep. Many people develop the habit of going to the bathroom only out of reflex or convention without paying attention to how they are urinating. Urination in a hurry without waiting for complete emptying can leave significant residues in the bladder. Over time, even a modest amount of new urine added to the residual volume can cause a feeling of fullness and urgency. This is even more relevant among people with weakened bladder detrusor muscles or changes in the urethra, as is often the case in men with benign prostate enlargement. In these cases, the double voiding technique, that is, urinating, waiting a few minutes, and trying to urinate again, can be extremely helpful in ensuring maximum emptying before bedtime. Another harmful behavior is related to the time of fluid intake. The idea that it is necessary to drink water until just before bedtime, often reinforced by generic hydration campaigns, can be detrimental to sleep health. The body does need good hydration, but the distribution of fluids throughout the day is what makes the difference. Drinking large amounts after sunset, especially in the 2 or 3 hours before bedtime, is an invitation to kidney hyperactivity during the night. The problem is further aggravated when the liquids ingested are natural diuretics, such as herbal teas, citrus juices, or even soft drinks. The result is a constantly filling bladder, unable to keep up with the rhythm of deep sleep, leading to recurrent awakenings. The most sensible recommendation is to concentrate hydration in the morning and early afternoon, gradually reducing fluid intake in the evening. But fluid intake is not the only dietary habit to watch out for. Foods high in salt or sugar eaten at dinner or as a late-night snack also interfere with the body's fluid balance. The sodium present in salty foods contributes to fluid retention during the day, which is often redistributed and eliminated during the night, especially when the body is in a horizontal position. Sugar, in turn, can interfere with blood glucose levels, and in people who are predisposed to diabetes or already diagnosed with the condition, this leads to an increase in urine production. So-called nocturnal polyuria is a classic symptom of glycemic control. Thus, the habit of consuming desserts or sweet drinks at night can be a silent but decisive factor in stimulating urination during sleep. Another factor that few people associate with urinary function is the use of electronic devices before bedtime. Exposure to blue light emitted by cell phones, tablets, and televisions interferes with the production of melatonin, the sleep hormone. Lower melatonin levels lead to lighter, more fragmented sleep, which increases the chance of waking up at the slightest stimulus, such as the slight pressure exerted by a bladder that is not yet completely full. In addition, mental stress caused by stimulating content such as negative news, discussions on social media, or even exciting TV series can raise levels of cortisol and adrenaline, hormones that activate the nervous system and impact bladder regulation. This prolonged state of alertness, even after the body has rested in bed, compromises the relaxation necessary to maintain continuous and peaceful sleep. The bedroom environment is also worth mentioning. An excessively cold room, for example, can stimulate the body to produce more urine. This is because cold causes peripheral vasoconstriction and redirects blood to vital organs, increasing blood volume in the kidneys and consequently glomerular filtration. This phenomenon is known as cold-induced diuresis. A room with a very low temperature at night can therefore be a contributing factor to nighttime urination. In addition to temperature, the thermal comfort of bedding, air humidity, and even the presence of noise in the environment also play important roles. Any element that disturbs sleep, even briefly, can allow the brain to perceive signals from the bladder and decide that it is time to wake up. There is also a behavioral component. Anxiety related to the fear of urinating in bed or not being able to make it to the bathroom in time, creates a psychological cycle that intensifies the perception of urgency. In many older adults, this fear sets in silently, sometimes after an episode of incontinence or a nighttime accident, and begins to unconsciously control the rhythm of sleep. The person begins to get up several times, just in case, even without any real physiological need. This conditioned behavior interferes with the quality of rest and feeds a pattern that is difficult to break. Working on this emotional aspect, often with psychological support, is as important as observing physical factors. Therefore, nighttime habits form a powerful set of influences that can amplify nocturia. None of these factors alone is usually the sole cause of the problem, but when combined, they create a physiological and behavioral environment conducive to constant sleep disruption. Establishing a more conscious nighttime routine, tailored to the body's needs and respectful of its limits, is a decisive step in the quest for more peaceful nights and a less active bladder while we sleep. Avoiding waking up during the night to urinate is a common desire, especially among older adults who experience constant sleep interruptions due to nocturia. Although the factors that lead to this disorder are varied, including physiological changes, medication use, pre-existing medical conditions, and even behavioral habits, there are practical strategies that, if adopted with discipline and attention, can significantly reduce the frequency of nighttime urination. These measures do not necessarily involve invasive treatments or medication. On the contrary, they are simple changes in routine, but they require commitment and understanding of one's own body. One of the first fundamental recommendations is to reorganize fluid intake throughout the day. Most people know that staying hydrated is essential for health, but the mistake lies in the distribution of that hydration. Often, due to negligence during the day or fear of dehydration, people end up drinking large amounts of water in the late afternoon or even at night. This behavior, which seems logical at first glance, has a direct effect on urine production during sleep. Ideally, most fluid intake should occur in the early hours of the day, between breakfast and mid-afternoon. From 5 or 6 p.m. onwards, consumption should be gradually reduced, leaving only small amounts for the evening, just enough to avoid feeling thirsty or to take medication that really requires fluid intake. Another simple but extremely effective practice is to urinate before bed. This habit may seem obvious, but many people do not do it properly. Urinating quickly without paying attention to the process can leave residue in the bladder, especially in individuals with problems emptying their bladder completely, such as men with prostatic hyperplasia or women with pelvic floor disorders. The double voiding technique recommended by urologists consists of urinating normally, waiting 2 to 5 minutes, and then trying to urinate again. This process allows the bladder to empty more completely, reducing the risk of urine accumulation during the onset of sleep and delaying the next urge to urinate. Controlling your diet at night is also essential. Foods high in sodium, such as processed meats, canned foods, aged cheeses, ready meals, or fast foods cause fluid retention during the day. When the body relaxes at night, it tries to eliminate this excess sodium through urine, which results in increased urine production in the first hours of sleep. Similarly, meals that are very high in sugar or simple carbohydrates also affect the body's water balance, especially in people with insulin resistance or diabetes. Ideally, dinner should be light, low in fat, low in salt, and without excess fluids. Avoiding sweet desserts and stimulant drinks, such as soft drinks or citrus juices, can contribute positively to nighttime bladder balance. Avoiding diuretic substances at the end of the day is another crucial recommendation. Many people do not realize that they consume natural diuretics at night. Coffee, dark teas such as black tea and green tea, caffeinated soft drinks, alcoholic beverages, and even chocolate act on the kidneys, stimulating the elimination of fluids. Caffeine, in particular, also impairs sleep by acting as a stimulant of the central nervous system. Alcohol, in addition to being a diuretic, fragments sleep and increases episodes of micro-awakenings. Replacing these beverages with neutral alternatives, such as small amounts of water or soothing teas without caffeine, chamomile, fennel, lemon balm, can help reduce urine production during the night without interfering with sleep. In addition to dietary adjustments, it is necessary to take care of the sleeping environment. Sleeping in a very cold room can cause a phenomenon known as cold diuresis, which occurs when the body, in an attempt to maintain its internal temperature, increases renal filtration and consequently urine production. The sensation of cold can also cause involuntary bladder contractions, increasing the feeling of urgency. Keeping the bedroom at the right temperature, wearing appropriate sleepwear, and using thermal blankets can help minimize this additional stimulus to the urinary system. Another often overlooked factor is the impact of stress and anxiety on the body. The autonomic nervous system, which regulates, among other functions, bladder function, is highly sensitive to emotional state. Anxiety, especially before bedtime, can increase bodily awareness, causing a person to feel their bladder is full even before before it reaches its actual capacity. Relaxation techniques, meditation, deep breathing, and even light yoga at the end of the day can help reduce nervous system hyperactivity and provide a state of greater physiological balance. For some people, the simple habit of turning off screens at least an hour before bedtime makes a significant difference in sleep quality and reduces the perception of urinary urgency. For cases in which nocturia persists, despite all dietary, hydration, and environmental precautions, it is recommended to monitor urinary patterns. This can be done through a bladder diary, a notebook where you record the times you urinate, the estimated volume of urine, the foods and liquids you consume, and your perceived sleep quality. This type of record helps identify hidden patterns and provides the doctor with more accurate information when making a diagnosis and recommending the best treatment. In many cases, simply viewing the data leads to conscious decisions by the patient, who begins to perceive more clearly the influence of their own habits on their sleep. It is also worth noting that strengthening the pelvic floor, especially among women, can be extremely beneficial. Regular Kegel exercises, for example, help improve bladder control by increasing muscle strength and reducing episodes of urgency. Men can also benefit from these exercises, especially after prostate surgery. Guidance from a physical therapist specializing in urogynecology can be an effective path for those who wish to explore this approach. All of these precautions are complementary strategies, and none of them should be treated in isolation. The body functions as an integrated system where each action causes chain reactions. When the goal is to improve sleep quality and avoid trips to the bathroom during the night, it is essential to consider all factors that affect the urinary system and sleep patterns. Each person will have a more sensitive point to adjust. For some, it will be the time of day they drink tea. For others, the temperature of the bedroom or the composition of their dinner. But it is the combination of these adjustments, made with attention and consistency, that will bring the best results.